Hello, my name is Folashade, and I'll be talking about the Nifty process. Congenital anomalies, which are also known as birth defects, contribute to neonatal and infant morbidity and mortality, and this can be identified prenatally, at birth, or later on in life. The World Health Organization has attributed 17 to 42% of infant mortality to congenital anomalies. Prenatal diagnosis is a science of identifying such birth defects, but so far the existing methods are amniocentesis and chorionic villus sampling (CVS), and these are invasive and they come with the risk of miscarriages. So how do we detect these birth defects without posing a risk? Non-invasive fetal trisomy test (NIFT) was the first non-invasive prenatal test to enter clinical testing in 2010, and this has been validated by a study on nearly 147,000 pregnancies. It is a test that screens for the common trisomy 21, 18 and 13, the sex chromosome aneuploidy, and the sex of the baby in most cases of single pregnancies. The following are people who should go for this test. Women over 35 who are concerned about their age-related risk of Down syndrome and other trisomies. Women under 35 who want a safe, reliable, early and accurate test for Down syndrome and other trisomies. Increased risk or high-risk results from a combined test or nuchal translucency scan, but still wish to avoid unnecessary invasive techniques and their risk of miscarriage. Previous pregnancy with a baby with trisomy or previous family history. So how is the Nifty process done? Call the clinic for an appointment when gestational age is 10 weeks and above. You sign all necessary consents, then collection of maternal blood sample is done, and then we await the results in 10 working days. Now there are three possible results. It could be high risk, that the result is indicative of a high risk for a trisomy, hence invasive screening test is recommended. Or it could be low risk, that is a 99 prediction that the fetus has no trisomy 21, 18 or 13, therefore there is no invasive screening needed. Or it could be sex determination. The test can be done to determine the sex of the unborn baby as early as 10 weeks gestation. All results should be interpreted by a clinician in the context of clinical and familial data. Patients should continue with their usual scan appointments following testing. Genomix is available for free genetic counseling if further clarifications are needed. So what could we say are the limitations to this test? This test could be less effective in the following category. If there is inadequate blood sample, if it's not for more than 2 gestations, and for 2 gestations, that's for the twins, the result on sex comes out as Y chromosome detection, meaning the possible results for twin pregnancy in terms of sex can only interpret as at least one of the twin is a male if the Y chromosome is detected. In this case, it does not specify if 2 males or 1 female and 1 male. None of the fetus is male if the Y chromosome is not detected. It cannot test for less than 10 weeks gestation, and it also cannot test for single gene diseases such as sickle cell. Independent validation studies, including the world's largest study on the use of non-invasive prenatal testing in clinical practice, have shown that Nifty has an accuracy rate of over 99% for detection of this condition. There is no physical risk to the mother or the baby. As there is no cure for chromosomal anomalies, continuation or termination of the pregnancy are the only options for expecting parents after this discovery. An early detection of the chromosomal anomaly has certain advantages, such as more time for decision making, privacy as fewer people are aware of the pregnancy, better management of pregnancy, and birth and safer methods of termination.